Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. We know everybody, we have come across so many what about cancer, knowing about cancer, how the cancer works, how the treatment works. But have you ever realized how the coping from cancer is really plays an important role? Coping with a cancer diagnosis can be incredibly challenging, but there are steps available to help manage your emotions and navigate through these difficult timings. So we can all let's understand this steps with our expert, Dr. Krishnamani, an esteemed and experienced medical professional specialized in medical oncology. Doctor, requesting you to give some opening insights to this exciting and emotion-filled session, Doctor.
Hello and everyone. Welcome you all to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. Today we are talking on coping with the diagnosis of cancer. You may call this as an extension of our previous session, which was on mental health in cancer. So this is something which cannot be taught in schools or in medical schools or in hospitals. This has to be learned, and this is a dynamic process. By that, what I mean is, this is a challenge which we see every day. Every cancer patient, he or she will face in their life. To cope with the diagnosis when they are first confronted to the word cancer or the diagnosis, what they go through during the phase of investigating if they probably have cancer, and what they go through once they are being treated and also after follow-up. So coping with cancer is a big thing in itself, and it's not an easy task. There's a lot of mental and emotional baggage which goes with it. And that is what we want to discuss today, on what the issues on hand are, or the problems on hand, and what we can do to try to ameliorate or maybe improve or help our patients and their caregivers.
Thank you, Doctor. Thanks a lot. So, Doctor, as you rightly said, this is a very critical pause, or which is a critical stage. So, doctor, generally the day when a patient comes to know that he has been diagnosed or the diagnosis is the first known, what is generally the usual reaction you see among your patients and their families?
See, cancer evokes fear in the minds of people. It brings a tear to many people. Okay.
Very true.
The question is, why me? If I am not there, what if I am not there, what about my children, my kith and kin? Okay. And the process could be painful. So the pain in other people is the first thing, or negativity is the first thing which easily attracts someone. So if somebody has gone through some pain due to chemotherapy or surgery or whatever, that will first come to your mind, rather than some person who has had a good result with chemo or done well with immunotherapy, etc. I'm just giving you an example. The first thing which will strike to their mind is, oh, this person had so many problems with surgery or radiation, etc. You will not remember the two other good people who had a good result. So the minute the word cancer is uttered, there is fear, there is shock, there is a sense of negativity, depression, a lot of emotions. It's a mix, and it is not the same at every point in time. You may have a different emotion. The patient will have a different emotion in front of the doctor during the conversation the first time around. After going back, during the journey back home, when the doctor's words sink in that you have had cancer, it is stage 2, we need chemotherapy, you'll be cured. But still, that word chemotherapy, the word hair fall, weakness, vomiting, those will play on your mind more than you have stage 2 cancer or early cancer or you'll be cured. This differs from person to person on what your nature is also, but this is the raw emotion which somebody goes through the minute they are confronted with a diagnosis. And after that, till they go home, even if after they reach home, what all goes on in the back of their mind. So this is a whole, this is a thing which is not just confined to that consultation chamber. It's your journey back home. In your home, you don't get to sleep. You are probably unable to sleep. You are jittery. You are anxious. Look. So this is about coping with the diagnosis. So how are we going to cope? So these are the issues. It is there now. It is there in front of us. The diagnosis is
Yes.
staring in front of us. How do we do well so that physically, mentally, emotionally, we are in a good space?
As Dr. rightly said that there are two conditions. Some positivity is also there. Somebody got cured, but instead of that, we tend to think on a negative trend that what if we won't get cured?
Yeah, so that is always there because
Yes.
see, mm, there are too many strings attached, right?
Hmm.
There are too many strings attached. How much ever you might tell me that I have got a very early stage cancer and all that, but it is me who is going through the pain and suffering. So sitting on the other side of the table is very easy. Giving advice is very easy. When I give advice, it is knowledgeable advice, scientific advice, but I should also understand from the person who's sitting on the other side what he or she is going through. So that is why you have to be scientific. You have to be very candid in your conversation. You have to communicate very properly. You have to document. My teacher used to say, communicate, document, that is write everything, document your communication. That means whatever you have said, document that. If you say you have stage 4 disease, write it also on the piece of paper and give it to them and communicate your documentation. No, don't keep writing everything, stage 4, not curable, palliation. Tell that also. Because the patient should know. Nobody can go and read up everything again. So communication, communication of documentation of communication are the four pillars around which the doctor-patient relationship holds. And if this is done, it will aid in our patients and their families to cope with the diagnosis.
Wow, doctor, that's actually the real-time experiences which will help the patients, doctor, to how to cope after knowing the diagnosis. Doctor, in this digital era, how the impact of information on the net and web is playing its role, doctor?
So it's like, see, there is a lot of information on the web.
Ye-
It's up to us how we are able to get that information. Some information may be real junk. This is again one of my teachers who used to use this word. The information is junk sometimes, but there is very good information available. So use, for example, just say pain in the abdominal pain, vomiting. Okay, an ordinary person, suppose he or she is having this problem, he types this in Google. You will get a list of things, including it could be pancreatic cancer, biliary cancer, stomach cancer, advanced stage, gone, fuses out. You may have had biryani last night or some stale food from the refrigerator and have gastroenteritis. Google will not tell you the percentage of what could be what. It will just give you acute gastroenteritis, cholecystitis, gallbladder stone, kidney stone, cancer, stomach, pancreas. You will look at stomach and pancreas. That's all. Hell breaks loose. That night you will not sleep. You will vomit even more. You will go in the morning and eat the head of your doctor saying that do this test, that test. Do I have cancer, doctor? What shall we do? My father's father had cancer. We don't know some 50 years back. That time no treatment. So now everything will come in your flashback. Even your unrelated relative also will come to your flashback who had cancer or did not have cancer, and you will try to relate that with your present life now. And the simple thing was you probably ate some stale food yesterday. That's why you are having all this problem. So what I'm telling you is not for a joke, but this is what we see very commonly.
Very true. Yes.
Okay. So symptoms, what is written in the web or what is described on Google, you will have abdominal pain for 1,000 reasons, including cancer. You can have chest pain because of heart attack also, because of gastritis also, because of a tumor also, okay, or because of trauma. anything. But for anything and everything, you start thinking of cancer. So that's why when you navigate through the web also, when you do a web search also, obviously the educated are and the intelligent, they would be aware. But for a common man, be very careful. Don't take these things with a pinch of salt. Take them with a bucket of salt. And that is not the holy grail. Your doctor is the final person who can either say that you have cancer or don't have cancer. Don't come to assumptions reading everything on Google. That is why what I would say is artificial intelligence is still artificial because it cannot supersede man. And it is we who make all that. So for that reason, primarily, your web search should be assisting you, but it should not lead to your anxiety for unnecessary things. It should be a door for you to connect with people who have similar issues, if at all you are diagnosed with cancer, patient advocacy groups, things like that, or some NGOs, okay, some associations, but not for bringing up your anxiety and your blood pressure on things which are trivial or having no meaning.
Already, doctor, you rightly said the patient, if he has stomach pain and vomiting, he is already tensed. It will also raise little bit of a BP after reading into the, like reading what's available on Google. So it's like a add-on information will add on problems.
And let's not forget that also on the web, many things is search engine optimized. So the
Yes.
number one hit which you see may not be number one as per your requirement. It is number one as per his search engine optimization.
Yes. So that's very true. Whatever generally the search engine optimize on the way the payment is happening. So for something on cancer, the payment is high, automatically it will appear first when you type
True.
anything. So
And
doctor,
also
what?
understand,
Sorry.
we don't have that much time in this generation now. People don't have that much time. In 5 lines, they want all the information.
Yes.
So we have a Bible called Harrison in internal medicine. Now, if you open abdominal pain, he will give you 4 or 5 pages, which when he beautifully, he will write everything and he will say, this kind of pain, this is this kind of pain, this is this. We don't have that much time. Google is not a medical textbook. We are not ordinary medical people. We are not medical people. We are patients, laymen. So don't take Google, that's what, no, take it to the bucket of salt. And some doubt is there, just chuck it. First, meet your doctor and get your doubts cleared.
Very true, doctor. In many of the times, no, in general conversation also, are you do it Google, na? You Google it, you will get it. You Google it. So that
Right.
also need to be rectified, and you should say that Google it and consult a right person for right information.
Perfect.
Doctor, then what are the ways a patient tries to get information apart from this, doctor?
See, uh, suppose somebody is diagnosed with cancer, they would obviously be followed up or being treated in a hospital. Your doctor is your first source of information. Ask your doctor for websites or handouts which he or she would recommend, which would be useful for you. And then I said there are associations, there are NGOs, there are patient advocacy groups. Okay, so that is the way. Or there are, now for example, the American Cancer Association, the Indian Cancer Society. All these organizations have, or the NCCN, the National Comprehensive Cancer Network by the United States, all these have specific areas designated for patients where you will be given information from a patient point of view. Excuse me. So, your first and last source of information should always be your doctor. Be frank, be open, ask him or her everything, and they will explain. Ask them for some handouts. Go through the web, preferably if they are able to give you some recommendations. Cancer.org, American Cancer Society, Indian Cancer Society, NCCN for patients are excellent sites. For blood cancer patients, Blood is a website which is an excellent site. For American Hematology Association, AHA we call it. And many philanthropists, many doctors, they have their own websites. In India, one of the largest hospital for cancer is Tata Memorial Center. Tata Memorial has a helpline for patients. Tata Memorial also on its website has an assistance for patients where information is also sought for. So all these are the various ways in which patients can get information.
In fact, doctor, apart from this only, the right source doctor, and also there are many of the psychiatrists can also help in this, doctor. Will that
Yes.
good source?
So psychiatrists, psychologists, counselors, patients who are treated, they themselves are counselors. That is the advocacy group which we call groups of patients. They have regular meetings. So all these will help you.
So, doctor, when you hear like second opinion on that, what is your insights on that?
See, what is second opinion? You see someone,
Hmm.
you want another person's opinion. Number one. See, the first thing which I would want people to understand here is cancer is a diagnosis which is based on pathology. Pathology means tumor tissue. You do a biopsy. On the biopsy, you see cancer cells. Then you say you have cancer. Cancer is such a complex subject. The biopsy report can be interpreted sometimes differently by experienced pathologists. So the first thing is, if it's a regular case of ordinary cancer which has been reported from a decent hospital or a decent lab, go ahead. Your second opinion will be most important in a rare case where it is always better to show a pathologist the second time, some senior pathologist or experienced pathologist. Many a times, the common man's emphasis is to go to some VIP clinician. Imagine somebody has come to you today. You say it's an ordinary breast cancer patient. She comes to you, you say you have breast cancer stage 2. She wants a second opinion. She is right to take a second opinion. She comes to Krishnamani because she thinks, oh, I am a big doctor, I'm a hotshot clinician, and she comes to me. No harm, come, I will tell you. But more important, what people should understand is when the diagnosis is dicey, many a times in the first attempt, you will not get a diagnosis. You will do multiple tests, still you are unable to come to a conclusion. There, a second opinion on pathology is more important. Then second opinion on clinical evaluation to a medical oncologist or a surgical or radiation oncologist is okay. So second opinion means taking a second opinion from a second person. Always in difficult cases, second opinion pathology is the first thing which we should do. We don't give much importance to our pathologist. The layman doesn't know at all. The pathologist, if he is not there, he or she is not there, my diagnosis of cancer or my treatment is not there at all.
Yes.
That anyway, it is not the patient's responsibility. The clinician will say, see, madam, I have a doubt in your diagnosis, so let us get it checked by another pathologist. So he or the clinician himself will say, get a second opinion. That is the important thing I wanted to stress, because in second opinion means what do we think? Okay, we send one online opinion somewhere, somebody from Tata Hospital or somebody big doctor from Bombay or Delhi will reply back. That is okay. Or you go to another hospital or you come to me, you take one. That is okay. But more importantly, in difficult situations, a second pathology opinion is a very important thing, because that one step will take you in a different path. Okay. The other thing is now what you have spoken about, what is second opinion? Yeah. So everybody has a right to go and ask. So you come to me, I give you a suggestion, you feel you want another suggestion, or you don't like my suggestion, or you feel you just for the heck of it you want to, you are all within your rights. So you go to another hospital, ask another doctor. Now the issue comes when two people differ. You don't know what to take.
Very
That is
true.
why in cancer it is always a multidisciplinary intervention where three or four people together, surgeon, pathologist, medical oncologist, radiation oncologist, everybody, and it is called a tumor board. So when things are run through a tumor board, then you can always tell your patient, see, this is a difficult case. It is a very rare case. Everybody's experiences is limited. So we have put your case through our tumor board. and this is our consensus opinion. Once you give a recommendation on a paper that it's a tumor board opinion, tomorrow if that patient comes to me for second opinion, even I will be cautious, and I will also know, no, this person has, a lot of people have taken interest in this particular rare case, and they have come to this conclusion. But the caveat in our country is, see, in the West, you cannot take a second opinion just like that.
Mhm.
Opinions are also based on insurance and all that. You have to shell out money from your pocket
Yes.
if you just want to hop around and take opinions. In India, it is not like that. You can pay 800 rupees here, 1000 rupees in another hospital. So within 5 hours, you can go to 5 oncologists and take opinions in Hyderabad now.
Yes.
So does that make you any wise? Does that make you any great? No, you are stupid and foolish. You are running around to 5 places for a simple thing. Rather trust someone. So the basic thing here is trust. So the bottom line is, I'm not saying don't take a second opinion, but there are people who are fond of going to 5 people, 6 people same day. That makes no sense, because of which you are delaying your treatment. And some person gives you a different kind of an advice, then you are stuck. So second opinion should be helping you to come to a conclusion quickly rather than delaying your treatment. That's the bottom line.
In fact, doctor rightly said, in Hyderabad only, I have seen one, two examples. They go for five, six opinions, but not to the right doctor. They will go back to their family doctor, who is a physician, normal MD physician, with, I guess, a very less practice of oncology. So they run back to that doctor. What should we do? Doctor will again guide to go to some other doctor. So it is
Correct.
delay.
So they go back to the family doctor because of the faith they have, and they've been treating
Yes,
them for
yes.
years together from childhood. I am okay with that also. That's also not an issue. Issue is people, some few people I've seen. I have definitely seen few people, and everybody will vouch for that. They just have a fancy of going to multiple places and showing. It is not necessary. Rather, if you have so much doubt, go to the expert whom you think in the country is the best. Travel to Delhi, travel to Hyderabad, travel to the West, wherever that person is there. But for an ordinary breast cancer, lung cancer, most cases, one maximum two opinions. If they concur, stick with someone whom you have trust. There's a patient who came to us once. We gave an opinion. Then she tells me, I went to another hospital. They also gave the same opinion. So now you are unhappy because two oncologists have given the same opinion. This doesn't make sense. You should be happy that I have spoken something which is exactly the same as the previous person, and it validates your concern, and now you are free to choose where to go. So you have made up your mind that you want to test that first doctor, and you're unhappy that the second doctor is giving the same opinion. It's a simple case. Everybody will say if you have blood pressure, you take so and
Whatever.
so medicine. What is the rocket science in that? So that is the psyche that we have to change. That is because too much is available very easily for us, especially in the metros.
Yes, yes. uh, it is also said that too many things, too much analysis will lead to paralysis. Kind
Correct.
of a concept is
Oh,
getting implemented.
the olden golden rule is very good. See, faith, trust are the most important. The poorest or the poor, again, this is something which my teacher used to say. The poorest of the poor have so much faith. They will just come and submit to the doctor. They'll say, sir, you take care. God is there, you are there, you guys take care. That doesn't, I'm not trying to say that no, the doctors are God and they're next to God. No, no, no. Sometimes that, see, what he has done is he has put all the burden on you, the mental burden and all that is on you. Sir, I will not break my head. You take care of me. Rest, it is in God's hands or in nature's hands. So that fellow is free. The highly educated fellow, the picky fellow, or the choosy fellow, he will start looking at everything with a uh,
Microscope.
with a glass. It makes life difficult for him.
Very true.
That is the issue. If you explain all the side effects of chemotherapy, if he has no side effects also, I didn't get any side effect. Did doctor really give me chemotherapy? You explain most side effects. Some small side effect has come. For example, the skin on the nails. The nails have become a bit dark in color. But if a doctor didn't tell me this, has my cancer spread to my nails? See, so overthinking is not good. You trust your doctor, come, this is your diagnosis, take your treatment. He has told you this is going to happen. These are the general things. Eat well, gargle your mouth, take your vomiting medicines, take your WBC shots, come back on time whenever he calls you, do your blood tests, lead a healthy life, balanced diet, home food, minimal exercise. Concentrate on this. Don't go on Google, don't talk to some friend because people are ready to give you free information. They'll hang up and they'll be happy. Your brain starts working.
Very true, very true. Anyhow, in India, it's a policy. Free advice is available everywhere, kind of a
Anyway,
thing. So, right advice is, as you rightly said, trust your doctor. Right advice will lead to less problems with good solutions, good
very
result.
much, very much, very much.
So, doctor, like what in this kind of a situation, what is the important role of families and friends in cancer diagnosis?
The less I talk about them is, uh, what do you say? It cannot be overemphasized. They are the pillar. They are the most important part. Imagine I take chemotherapy and I go home today and there's no one in my house. I am a single person.
Mhm.
Imagine mine. Whom do I talk to? If I vomit also, if I need a glass of water also, I have to only go. I have to only take, prepare my own food. Okay? Nobody is even there to check my temperature. Imagine I am living in a family. My parents, my spouse, my children, my friends are there. Somebody will come and check. Somebody will say, no, 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 less spicy food for you. This kind of easily digestible food for you. Are you taking the medicines on time? Sit and have a conversation with you. They will chat with you. They will try to divert your attention from today's chemotherapy or surgery or whatever. And so for all this, the moral support, emotional support, the spiritual support, the financial support, you need everyone. We live, like we discussed last time, we live in a society where we need people. So, especially in bad times like these, and when it hits your health, it is the
Mhm.
worst. 3 days lie down with viral fever with back, body pains, and 103 temperature, we'll start feeling that life has come to an end. Imagine a cancer patient who is going through hell, and
Yes.
he or she knows that he has to go through this hell again 2 weeks later or 3 weeks later. Okay. See, the there is a saying that there is a silver lining on every cloud. So this patient knows tomorrow, okay, I'll get cured. But to reach there, first 4.5 months of chemotherapy you have to take. Hair fall will be there, nausea will be there, vomiting will be there, WBC counts will fall, infections will be there, mouth will not have any taste, you can't eat your favorite items. Then, so that hope is required. So these people give them that hope. Come on, chalo. We'll also take this kind of food only with you. We'll also, for next 3, 4 months, let us not go out to any restaurant. Let us all eat home food. Let us not take spicy food. Let us eat together. Something to build up his or her morale so that at the end, once they complete their planned treatment on time, the results will always be better.
That's very true. Just rightly said, even when we were in hostel, one day also little bit of a health down, homesickness will start. We start missing our family. Just imagine how the cancer patient, if they don't have a pillar like family and friends, very difficult, doctor.
And each time they come for a scan is like an examination for them. They don't know, is the doctor going to say, I have got a recurrence or a relapse?
Yes.
Okay.
So,
So each time they come to the clinician is a, so it is not only during treatment, it is before starting treatment also when you are being diagnosed. Today they'll do a biopsy. Then the doctor will say it'll take 5 days for the biopsy report to come. It could be cancer. So that 5 days there is a tension. It could be cancer. What type of cancer? Then the PET scan, the report comes the next day. What stage I am in? Then once the treatment starts, the treatment issues. Post treatment, okay, thank God things are okay. But every third month when you are going, oh, if I get back the disease now, oh, what is my doctor going to say in this follow-up? What test is he going to get it done from now? And add to that the financial burden of it.
yeah,
Each scan, each blood test, each follow-up visit, each treatment. So that takes a toll. So that is coping with the diagnosis. It is not just the diagnosis alone, it is the treatment, the after effects, the follow-up, the surveillance, everything put to it.
in fact, cancer itself is a very tedious process, full process. Family will be one person who will at least remove the tension from cancer treatment.
See, in all my our years of medicine, I would say one thing. There is no disease, I think, which can evoke so much fear in the minds of people the minute
Yes.
the word is said.
Yes. Very true, doctor.
If you say you had a heart attack, the patient, if you tell me you had a heart attack today morning, we had to rush you and we put a stent in your heart. Fair enough. What? Same thing. Imagine you have cancer and you have to start treatment. That's it. Okay. So that word is something. So that is why it is imperative on us as clinicians, as stakeholders in cancer, that we do what best we can, so that it is not our job that they just pump in chemo or do surgery or radiation or whatever, but they are also informed about their disease in the right way and they're able to make the right choices and take the right decisions regarding their health.
Very true, doctor. Very true. Doctor, is there any issue in coping with cancer diagnosis, like any myth regarding treatment, disease, cure, food, etc., like that?
Yeah, so if you talk about food, the commonest myth is you eat sugar, cancer will grow. So people don't take sugar at all, people don't take salt at all, people don't take white items, no rice. Already chemotherapy, radiation, and surgery are causing tremendous issues with your diet. In that, you say, I will not do this. There is a scientific basis for it. Okay. So there are a lot of such issues. Just because somebody had some chemotherapy and had major side effects, people attribute it to every chemotherapy, even the simplest chemotherapies. All chemotherapies will not have so many side effects. Some are very simple. But because some relative of yours or some friend of yours went through terrible side effects or hell, every day you are going to sit like this when you're taking the simplest chemotherapy as though you will go through that hell.
Yeah.
So that has to change. You have to understand that cancer is different in different people. Same cancer is different in two people. Treatments are different in different people. People react in different ways to same treatment. Everybody need not go through the same set of side effects. And if you take certain basic precautions which are told by your doctor, your results will be good.
So it's like instead of copying and analyzing, you should ask doctor what will be the best way, what will be the best, and also uh, experience it instead of
Correct.
imagining something else.
Don't imagine, don't imagine.
Generally, we have a habit, Indians have a habit, like it's 1 rupee, we imagine that 1 rupee can be converted into 100 rupees. Just an imagination without any efforts. So even this is a small chemo, like you rightly said, the chemotherapy can be simple, but we imagine the most extreme condition of the chemotherapy.
Correct,
So, doctor,
correct,
then
correct.
then doctor, what will be your opinion, like staying informed or being positive? What will be your opinions on that?
So what all we went through just now, talk to your doctor, have information from the right sources. I listed you a list of websites or organizations. All this should be able to help us. Even in the vernacular language, in newspapers, every day nowadays there is so much information given out by hospitals and doctors. Read those and be well informed. On the radio, there is so much nowadays. Doctors are coming and talking. You can listen to that. There's podcasts available. Listen to that. All this will help you grow your knowledge.
In fact, doctor, there are many videos which is available in YouTube, including Cancer Reach, which can help them to go on a right path on a right time
Correct.
without
That's what the whole
guiding,
aim is.
without getting misguided. Yes.
True.
So, doctor, any advocacy groups are there, like suggestion from you, doctor?
Yes. So what is patient advocacy group is? It's a group of people who come together to help people with rare diseases or certain diseases. In prostate, you have in cancer, for example, in India, you have a prostate cancer. Okay, you have a breast cancer, and there are, as I told you, some helpline for patients who are taking chemotherapy or for some psychological help or psychosocial help on the phone, where there are counselors who would talk and allay people's anxiety. Always talk to your other patients who come to the hospital. Be in touch with them. Talk to your doctor. They will have a helpline for sure. So all this will help. Being in touch with people who are going through the process will make your job easier.
Doctor, like right now you have told there are so many podcasts available, FM, even doctors are speaking. Is there any place where a patient can find all those information, like, okay, this doctor podcast or this link for an advocacy, like that? Any shortcut or an easy accessible page, something is available for our cancer patients?
So see, for lay people, right? So as a
Hmm.
medical professional, I know there are certain cancer websites where if you go into that, you get cancer advocacies or you get patient-related information. But
Yes.
not everybody is a tech savvy or everybody can read English, especially in India, who can go into the web and all that. That is precisely the reason we are doing it through Cancer Reach, where we are also spreading information through the vernacular language. We have started off in Telugu first. We intend to
Yes.
do in Tamil. We intend to do it in Hindi next and Kannada also if we can. So at
Oh.
least the people living in the south and the northern belt can at
Hmm.
least get the information. There is also a plan on Cancer Reach now to start a patient advocacy group. Hopefully, in the next 2 weeks or so, we should be able to roll that project. In that case, it will be a small WhatsApp kind of a group where a few people will be there who will be able to help.
Hmm.
But this is what I'm talking about, our uh, this one. But otherwise, for example, e-cancer is a website. It's a very beautiful website for cancer medicine or e-cancer it is called. Go into that. There's a lot of information for patients. Okay, doctors themselves have a number of doctors have their own websites nowadays. So if you're going to your doctor and he has his own website, you can obviously go onto that and you can get some information. So the newspaper or print, the radio, the television, podcasts, web, medical journals or e-websites, your doctor per se, and such organizations.
In fact, sir, right now, previously we have discussed in this digital era, we tend to search for the information on Google. Instead of that, we should search for an advocacy kind of a group which will
Correct,
relieve the
correct,
patient from all
correct.
the
True,
tensions of cancer.
true.
So, doctor, this was such an emotionally attached thing on the coping with cancer and coping with diagnosing after getting diagnosed with cancer. So, doctor, by this we came to an session to the we have came to end to this session, doctor. Thank you very much, doctor, for this information. I hope whatever information is shared by you, doctor, today, will be helpful for each and every individuals. So, thank you, doctor. Doctor, would you like to give some closing comment to this coping with cancer diagnosis session?
Yeah, first of all, thank you. And so let our patients understand and their families understand that we are all there with them to help them cope with the diagnosis of cancer and to help through the journey of cancer. I am sure every one of your doctors who is treating you will is there with you. So do not feel you are alone. Do not feel you are left out. And in a country like India, where uh, cancer is quite a big thing, where the incidence of cancer is rising, and there are extremely good cancer specialists at most places, you will be in the right hands. So trust your doctor. Please follow their advice. You will do well. That is what we should understand, and we have to fight this battle to win. And do not forget the core principles of prevention, no tobacco, and screening and vaccination for certain cancers, which we have discussed multiple times on this platform.
Yes, doctor, very true. And just a small suggestion, please, please, please take care of your health. Avoid all those things which can lead you to some path which can lead end up with a cancer.
Okay.
So thank you everybody for joining us today. So stay informed, stay healthy from Cancer Reach. Thank you, doctor. Thank you,
Thank you.
everybody.